During a hospitalization last year, the doctor actually called in a physiotherapist because my mother was having pneumonia, and the physiotherapist was coming in to help do physiotherapy to move the fluid up the lungs. And at the same time, the physiotherapist also taught me how to do exercises. Because when old people lie down on the bed too long, right, and you don't actually move them, or they are quite inactive, even though they don't lie down, but if they are relatively inactive, their joints will get stiff and hardened. After a while, they start to actually go into a pretzel or fetal position, means they start to curl and their joints are very hard and very immobile. When you try to move them at that point of time, when they reach that state, it will be very, very painful. This is something my mother's friend who have experience in a retired nurse who cared for bedridden patients told me. Once you allow them to get into a fetal position and you try to straighten them, it becomes a very, very painful because they are basically their joint have stiffened up already. So the physiotherapist taught me how to do like simple exercise for my mom. You can actually talk to the physiotherapist if you're caring for a loved one who is actually bedridden, to what are the kind of exercise to do that you can actually do to help with the joint. I will also I will include the link of a video from the hospital in Singapore that actually teaches how to do exercises for the stroke-based patient, bed exercises, which I think will be quite helpful as well. Every day, I will actually do the exercise for my mother at least once. The main thing is that these exercises move the main joints in her body. Her elbow, her wrists, her shoulders, her hip and her thighs, and her ankle. Initially, when my mother was getting a bit stiff already, her hand, not fetal position yet, but it was getting stiff. So after doing these exercises, right, I find that then her joint become more nimble. So I have to move her when I have to change her diapers, or I have to move her to the wheelchair when I have to change the bed sheet. She doesn't wince in pain and all this. She is okay inside. And also sometimes the lack of pain will actually tend to make, when after she wake up from sleep, and then she will actually move her legs more because in the end they are not painful. So these exercises are actually very, very easy to do. The main thing is that you have to cover the joint. The physiotherapy told me like each side, hand, legs, each one is 30 times. But there are different set of exercises for like the arms. There's about one set, and then legs, there's about 4 different sets of exercise to move different part of the joint and the position. So this one, actually, if you do it every day, it just take you like maybe 10 minutes. Less than 15 minutes, you complete the exercise. It's about, each exercise is about 30 repetition. So it will definitely help. This is a very simple thing. It really helps to the blood flow, and also to prevent the stiffening their joints, and also give them some movement. So if you do it more than one time, maybe 2 or 3 times a day, so it will help to keep their joints nimble. Thank you.